Well, healthcare is the big story of the day, and Kathleen Sebelius is on the hot seat. Just about 15 minutes ago, just ended, and this was a big hearing about the Obamacare rollout. Another hearing yesterday also got heated. Marilyn Tavenner, the director of setting up the online exchanges, was the one getting grilled, but there was also a rather testy exchange between two lawmakers about the efforts to dismantle Obamacare. Take a listen.
What are you going to do about the approximately 17 million children with pre-existing conditions who can no longer be denied health insurance coverage?
Will the gentleman yield?
Yes, I will.
You ask a question, I'm going to answer it. It's a false choice to say it's Obamacare or nothing. There are numerous proposals, including the one that I'm a co-sponsor of.
I yield back.
It deals with pre-existing conditions.
You can sit there and say that you had a legitimate alternative after these years. We've gone through 44 votes, 48 votes now, of you trying to dismantle the legislation. You call that cooperation? I don't.
Will the gentleman yield?
I don't call that cooperation.
You're asking questions.
Right. No,
the gentleman's time has expired.
It's redundant.
Well, the congressman that stayed in his chair, Congressman Tim Griffin, joins us now. Also reached out to Congressman Bill Pascrell, who's been a friend of the show and has come on frequently. His office said he had a scheduling conflict today, so we look forward to talking to him. In the meantime, Congressman, it's great to have you on the program.
Thank you for having me.
What happened after that? Did you two have a chit-chat afterwards? We were wondering what was going to happen next.
No, actually, look, I don't think anyone on the committee really considered those antics to be serious. I think that was more for the camera, and apparently it worked. Look, he was talking to the committee as a whole, and he was basically saying what a lot of Democrats want the American people to believe, and that is that there are only two options. Two options if you're going to deal with pre-existing conditions, for example. Either Obamacare as it's being implemented or nothing at all. And that's just false.
Well, Congressman, if I could, just to give our viewers a little bit more context, part of what Congressman Pascrell said is, listen, we've been through this before with the Medicare prescription plan that was rolled out by the Bush administration. That's something Democrats did not support widely, but once it was law, we all got behind it. And his message to the Republicans is, where are you? We also heard that today in this hearing. I just want to play a little sound from Congressman Engel. He's a Democrat from New York. Here's what he had to say.
I find it disconcerting that my Republican colleagues have done nothing but root for this law to fail for the last 3.5 years, and now there's a big show here of being upset at problems with the website keeping people from signing up for coverage fast enough. So I would just say to my colleagues on the other side of the aisle, you're really on the wrong side of history here.
Congressman, we know, of course, that the health care law was passed with no Republican support at all, which makes it different from past laws. Do you think, though, should the fix to this law be bipartisan? Do you think that's part of what could be good for the country now?
Well, I'd say a couple things. First of all, the website is just a symptom. Eventually, I believe, they will get the website fixed at some point. The problem with this law, it is a Washington knows best, one-size-fits-all, top-down deal that tells all of the states how they're going to do it, and what it ultimately is leading to is a single-payer system. In fact, a doctor contacted me today, and he said, you know, I'm not hearing it out there, but that's what this is doing. And we're seeing this. We're pushing more people out of private insurance into the exchanges. More people are going to be pushed on to Medicaid. And look, I would say to my colleague that you just played, I would say, look, if you're for a single-payer system, yeah, you'll get behind Obamacare and you'll be a cheerleader for it. But a lot of us believe, unlike the bipartisan drug benefit that you referenced earlier, this law is fundamentally flawed. And we have an obligation, if that is in fact our beliefs and the beliefs of our constituents, we have an obligation to continue to make the points that we're making.
And Congressman, we'd love to have you come back on, too, to tell us a little bit about the legislation that you have, the bill. We're short on time today, but it's great to have you on the program, and we're going to continue, of course, to follow this story very closely. Thank you very much, sir. Great to have you. And we have a great panel coming up as